In today's video, I want to talk about health testing. You probably heard about health testing, but what exactly is it? There are two components to health testing. There is a DNA panel and genetic testing, and then there's structural, or what I call actual health testing, which means OFA, PenHip, etc. Now, two things are completely different. However, a good breeder uses both. I always say a good breeder uses as much information as they can get. So in that case, you would want to do a genetic panel and genetic health testing and actual health testing through OFA as well. It's important for you to understand that the important part of health testing is the structural health testing through OFA, the actual professional health testing, rather than a DNA panel, which can be done by just the owner by simply sending in a cheek swab. So there are two things. It's very important to understand the difference. Let's talk about the genetic DNA testing first. This is what most people use. However, some people only use the DNA panel, which is not enough. It is super important to understand that DNA panels are not enough. Very important. If you take anything away from this video, I want you to take away that DNA or genetic testing is not health testing. It is part of it, but it's not health testing. A DNA panel is done when you send in a cheek swab from your dog, so the owner usually does it themselves. You swab the cheek, you put it in a tube, and you send it off. There are different labs that do it. Animal Genetics, UC Davis, there's a few other ones. Embark is also very popular. And yes, genetic testing is important. So it's not something that you don't want a breeder to do. But what I really want you to understand is that a good breeder, will do more. Don't fall for people advertising their puppies or their breeding dogs as health testing when all they do is DNA testing. It is not enough. So the DNA panel, depending on breed, will check for genetic issues. In Frenchies, we have juvenile cataracts, we have HUU, we have cystinuria, so there are some things we need to check on the genetic side of things. Now, most of these genetic illnesses, Frenchies aren't generally affected by anyway. Occasionally you get a carrier or an affected, which again would be important to know, because that way you can then breed them to a clear, but that's a whole nother video. But in general terms, Frenchies aren't usually affected by these genetic issues. Now let's talk about the OFA side of health testing. This is the important part. Now, depending on breed, there are different health testings you can do through OFA. Very important for Frenchies are hips, spine, trachea, patella, eyes, and cardiac. Those are the things you want to see a breeder do. And you do want to see the official OFA results. Don't just take their word, because there are people out there who lie. So they will tell you, oh yeah, we do OFAs. Especially if you are the one asking for OFAs. They simply say, oh yes, we do those. Don't just take their word. Always verify. So you want to see the actual OFA results that they have gotten back, or because OFA is a public database, you can simply type in the registered name of the dog and the health test results should pop up. Now, the spinal database is not part of the public database, so that is something you will need to ask the owner of the dog for. So they will have the actual results, which will tell you what spinal vertebrae are affected. If the dog does have spinal abnormalities, most Frenchies do, but you really need to pay attention to that, and you want to see the actual results. In an ideal world, the breeder will do all the OFA testing I had just mentioned. If they don't, I will tell you the two things you 100% want to see done are hips and spine. And Femi's having a drink. Just 1 second. So hips and spine, you absolutely need to see. For hips and spine, the dog is usually sedated and x-rays are taken. X-rays are needed for hips, spine, and trachea. For the tracheal x-rays, the dog needs to be awake which means that you can't usually get the trachea done at the same time you do hips and spine, because for hips and spine, the dog is generally sedated. Most people do 2 separate vet appointments, or you can have the trachea done before they sedate the dog for the hips and spine x-rays. The other testing, patella, is just a physical examination that any vet can do. And for cardiac and eyes, you do need to see a specialist. Now, they did change cardiac recently, so I do believe cardiac the basic cardiac exam can now be done through a regular vet, whereas before that you had to see a cardiologist. For eyes, you do need to see an ophthalmologist. I will be doing more videos on health testing and training, but I do hope this video gives you a first explanation of what health testing really is and what you need to ask your breeder for.